Hi, my name is Debbie Komisak. I am doing this presentation on the professional development plan. I am giving this presentation on a professional development plan to review how obtaining my BSN has helped me achieve my career goals. I started my career as an RN many years ago at age 21. Back then, an RN degree was all that was really needed, and finding a job was easy and plentiful. Over the years, I always thought I'd go back to school and get my BSN, but life and 4 children happened, and there never seemed to be a good time to start school and take time for myself. I achieved one of my goals for my career in 2018 by receiving a position in a children's hospital on an acute care pediatric floor. I had many years of pediatric experience, but lacked my BSN, and it was a condition of employment. So I found myself at age 54 signing up with American Sentinel to accomplish this requirement. I was excited to be working in the Children's Hospital and excited to finally be embarking on a journey to receive my bachelor's degree. My children were happy for me and thought it was neat that I was in school at my age, and they were proud of me also. I was excited to get started and looking forward to my new journey. In May of 2019, I started SIM 405. I remember clearly looking at the first assignment and crying, "What is a care map?" I don't even know what this assignment is about. Of course, I found out that through research it was a new term for a care plan, which was something I was very familiar with. Through the program, there were assignments that I breezed through, some I stressed out over, and also some that I shed tears until I knew what was required of me. While I've been in the program, I also successfully obtained my certification in pediatric nursing, another accomplishment I'm proud of. I find the importance of learning outcomes are needed to provide someone to know what the purpose of the learning material is meant to achieve. Program learning outcomes solidify the expectations set on the student, or in this case, myself. It is a culmination of all the information and subject matter I need to possess to achieve the title of a Bachelor of Science nurse. The purpose of this presentation is to present where I was and what I achieved by completing the courses to obtain my BSN. For assuming leadership roles in multidisciplinary teams, within the healthcare organizations, I have had the opportunity where I worked in the Children's Hospital to be a charge nurse. This initially was intimidating to me. However, with time and learning, I felt more comfortable assigning team nurses to appropriate assignments, being the go-to nurse when problems arose. I now know the term evidence-based nursing, what it is, and can use it in my practice when When I was in nursing school, that terminology was not used or even identified. I have been educated through the assignments on developing care plans for patients, for people of different communities based on the areas they reside in, be it rural or urban. I can now research evidence-based practice and know what it means and why it is so important to the nursing profession for the best outcomes of my patients. I learned from this program the terminology of Nick, Knock, Nanda, which were all foreign to me, and I learned the importance of using them to develop a prioritized nursing diagnosis. With doing the assignments in population health, I feel this was a very good learning experience by being exposed to ways to promote health and education to all different ages of individuals and families. I was able to research and learn about populations I am not exposed to, such as the elderly population and people in urban settings. I had the opportunity to research and be exposed to different age populations in shadow health, which I feel was very beneficial and very in-depth. Accepting accountability and responsibility for professional judgment and actions has impacted my practice in where I feel since I completed the program, I feel more empowered from my education to make me to help me make better professional decisions and also to be accountable for them. Being exposed to values and ethics impacted my practice to have an open mind and realize different cultures and values of other people and what they may possess. Contemporary health problems and illnesses was interesting in learning about how other areas of the world suffer with disease and how the World Health Organization helps to combat these diseases they suffer and how it is funded. The role of the global citizen is to be aware and intervene to those unfairly treated and undertreated in health care. It is the importance to provide empathy and understanding to those people less fortunate than us. A goal of mine would be to someday go on a mission to a less fortunate area of the world and help the citizens there by providing nursing care and education. I feel after studying for my BSN, I am more prepared to do so and look forward to the day when I could take a mission trip to help children in particular who need it so desperately. I have an understanding of the importance of collaboration, of working with other health groups to do the best for the people of communities. It is best in community health to reach out to all your community resources to identify what is available to your patients in the community and educate the people in the community of these resources. And these can be either health centers or perhaps an elderly center to enhance socialization for the patients. The coming together of all the resources provides the best outcome for the patient in a well-rounded way. Being exposed to the experience at the daycare center made me aware that we live in uncertain times and critical situations do and will occur. I feel I am better prepared for such a crisis by taking on a leadership role by the skills I developed and being able to be organized and speak clearly and directly in a time of crisis. I truly am proud of myself for accomplishing this course. After I had my ups and downs over the past 10 months, it was enlightening and offered me a more in-depth and well-rounded experience to add to my knowledge of being a registered nurse and complete the circle and now become an RN with my BSN. Thank you.